Good evening, everyone. Thank you all for being here. I think when Tamaya is the venue, we don't have difficulty getting people to show up. So I see a few empty chairs, but it's certainly good to see you all here, and thank you so much for accepting the invitation, and particularly thankful to the Santa Ana Pueblo for so graciously inviting so many of us on a continuing basis to be a part of their community. I happen to be, but for those of you that don't know me, I'm Wayne Lindstrom, and I oversee behavioral health services for the state of New Mexico in the New Mexico Human Services Department. And among the many things that I end up doing, I also am a father of 6 children, all of whom are well into adulthood now, and have 6 grandchildren. And I was thinking back to my youngest son, who he was still in a car seat in the back seat. I don't know, maybe he was 4. And we were driving through the country. And he says to me at one point, "Dad, does God live on a farm?" And I said, "Yeah." Well, time went by again. He said, "Dad?" I said, "Yes." "Does God live in the woods?" And I said, "Yes." Another pause. "Dad, does God live in the sky?" I said, "Yes." And now there was really an extended pause. And he says, "Is he in my sock?" And my motivation for sharing that with you is that, you know, out of the mouths of babes, there's this inquisitiveness, openness, eager to learn, oftentimes amazing wisdom, and somehow, you know, over the course of our development and becoming adults, etc., a lot of that can erode for all of us. And when I think about the work that we do relative to the opioid crisis, we come to it oftentimes with all kinds of prejudices about the population. You know, maybe these are folks that have a moral weakness or a character defect, or we've been really oriented to an abstinence model, and therefore we can't possibly accept that MATS has a lot of support and evidence behind it, etc. So I want to encourage us all to further come to the table and embrace the work that we have to do with an open mind and with grace and with mutual support. We've made great strides in the state of New Mexico, and Dr. Grace, who's going to be speaking in a moment about how far ahead of the curve we've been relative to public policy in this arena. The majority of states can only begin to dream about a lot of the things that we pioneered here in New Mexico. For many years, we led the nation. We were the capital of the country in terms of drug overdose deaths, particularly around heroin. We've had a multi-generational problem in this state. But for the first time over the last 3 years, we've really seen that escalating trend plateau. And it's really thanks to all of you and the folks that we work with every day that have made that difference. And one of the most heartening things that I heard this week is that in the last year, we have increased our overdose reversals by almost 61% in just the last year. 650 people are alive today that otherwise wouldn't have been. The other thing I want to leave you with before I introduce Dr. Grace is that much of what you're going to hear tonight has to do with harm reduction and treatment, medication-assisted treatment. But I never want us to lose sight of the fact that we've had a history of dealing with these problems far too late, and that if we're ever to get ahead of the ball game, and I assume we all know this, we've got to get far upstream. And while we're talking about, you know, some of our investments in the state targeted response monies and our state opioid response money from the federal government, and around treatment, we also were successful in having the federal government lift the cap on prevention. And we had already begun an investment 3 years ago in the implementation of the PACS Good Behavior Games, which is 50 years old this year. It's a primary prevention methodology that has more research behind it, a lot of it out of Johns Hopkins, than any other primary prevention methodology. The ROI, the return on investment, is projected to be $68 for every dollar we invest. And in every school that we implement this in New Mexico, and we're now in over 50 schools and something like 16 different school districts, and this year we're introducing the Good Behavior Games in the Bureau of Indian Education schools, we see within 90 days of implementation up to a 70% drop in inattentive behaviors and disruptive behaviors. And these children learn how to develop the competency around self-regulation, which carries with them that competency throughout the trajectory of their lives. So these become resilient kids despite what life has thrown at them and may yet throw at them into the future. So I want us all to not always just focus on treatment, harm reduction, early intervention, but primary prevention up front. So those are my introductory remarks for this evening. And with that, let me introduce you to the new Secretary of the New Mexico Human Services Department, Dr. Scrace. Many of you may know him from his days at Presbyterian Health Plan, Presbyterian Health Services, more lately at the University of New Mexico. And with that, Dr. Scrace, thank you.